Lewis, we've heard about a lot of businesses who have said, including places like Papa John's Pizza and some of the Darden restaurants and many others, that because of Obamacare, because of the Affordable Care Act, they're going to start messing with the letter of the law and the number of hours their employees are working and the number of employees per store to try to avoid providing their employees health care because, as they say, it will be very, very expensive for them. We now have a story from Trader Joe's, as reported in the Washington Post by Sarah Cliff, that Trader Joe's is actually cutting health care to some employees because of Obamacare. The thing is, it's very, very different than what is going on at places like Papa John's and Darden restaurants. Trader Joe's has actually said, if you work less than 30 hours a week, we are going to cut your health insurance benefits because we simply can't provide anywhere near the deal that you would be able to obtain through the exchanges that are being put in place by the Affordable Care Act. So they actually give an example, and they say, a crew member calls in the other day. They were unhappy that they were being dropped from our coverage unless they worked more hours. This particular worker is a single mom, one child, who makes $18 an hour, working 25 hours per week. We ran the numbers for her. She pays about $166 right now per month for her coverage through Trader Joe's. Because of the tax credits at her income level that she would be eligible for under Obamacare, she can go to one of the exchanges that's going to be set up and buy insurance that's almost the same as the coverage she gets through Trader Joe's for about $70 per month. Accordingly, by going to the exchange, she would save just under $1,200 each year, and that's not including the $500 that Trader Joe's will give her in January as a subsidy towards buying her own health insurance. This, to me, Lewis, is very, very good news, not only because this individual is saving money, but because we're really separating, at least in this case, health insurance from your employer. The $500 subsidy that Trader Joe's will give her is great, but even without it, she would still be saving money. And hopefully we're going in the direction of not having to make employment decisions based on keeping health care, which keeps people in jobs that they don't like, that they're not really productive in as a result of not liking it, and people making life decisions that they might not otherwise make simply to keep health care. This is good. I think we need to be separating health insurance from employers, and this, to me, is a potential success story through the Affordable Care Act.
Definitely, yeah. I mean, going back to the Papa John's thing, I think they would have had to increase the prices of their pizzas, 14 cents or something?
It was like 10 or 14 cents, yeah.
I think it's also a general misnomer that you're getting a lot for your money when you're purchasing health insurance through your employer. I think the vast majority of the time, you're really not saving much money compared to what you'd be paying normally out of pocket for a similar plan.
There are some people, like if you work at Trader Joe's part-time and you have, like, for example, a spouse who makes a lot of money, so you make too much money as a family to qualify for Obamacare subsidies, but at the same time, you're going to lose your health care through Trader Joe's. These individuals do exist, but remember, they're already making so much that they don't qualify for those subsidies. So the number of people that will be positively affected by this drastically overshadows the number that will be negatively affected.